I was going to ask you specifically, when you see people outside of magnesium deficiencies, when you look at inflammation in the gut specifically, are there certain things that you're like, that they're the main culprit for this inflammation? Maybe alcohol aside, because we know that one, but are there certain foods or things that people are doing that's like, that is a root cause that is causing this inflammation in everybody?
I would say it's a combination of the inflammatory core things plus alcohol. Like when I meant gluten-containing grains, there's industrial seed oils, sugar, dairy. That's got to be most people, a combination of those things day in, day out, cumulatively. That's the biggest problem. And then the stress and I think unresolved trauma up there too, of things that can perpetuate inflammation as well.
Well, I think it's important to talk. I got my blood work done. I get them like once a year, and not to be arrogant here or anything, but it came back and the blood work looked fine, right? And the vitamin levels looked fine. But
it's arrogant about your blood work?
Well, no, because I didn't want to be like, I have great blood work.
The demigod status.
It looked good, but I still didn't, I felt something was off still. And I was like, what's going on? So I went and got a gut test and like did a stool thing. And like, I had a problem with my gut.
He sent his poo in.
Yeah, I had to do all this stuff to fix it. And I'm like, if I didn't go that extra step to figure out what was going on in the gut, you would have looked at my blood work from my general practitioner, like, oh, everything's fine. And I think a lot of people go through life like that. It's like, oh, okay, like I'm in the levels, everything, nothing alarming. And they don't do the next thing because they didn't offer it. I had to like seek it out.
Yeah.
And that was a whole journey to like fix my gut.
Totally. And there's so many people that are like, okay, I know something's off here. So if the labs are coming back, quote unquote, normal, either you're not running the right labs or you're not interpreting the labs appropriately or both. It's a great example.
But 99% of people just think, okay, well, the labs are
I'm
the labs.
in the norm.
Yeah,
even though I'm having digestive issues or inflammation or brain fog. Yeah. That's where more comprehensive labs really are helpful to shed light on it.
Yep.
A lot of people right now especially want a free lunch. And what I mean by that is they want to do the Ozempic shot, the Wegovy shot. You guys have heard this.
Oh, yeah.
And a lot of people are doing it and saying they cut sugar or they're on a low carb diet. I went back to LA and I'm like, I'm like,
everybody in LA cut sugar all of a sudden.
Everyone's like, I cut sugar. I'm like, okay, what's really going on? What is you guys' opinion on that? Because listen, it seems great to be able to just do something and lose all this weight, but I feel like it's a free lunch. And I think that we haven't even began to see what is going to happen with this.
It scares me, but I want to hear Dr. Cole's response. Yeah.
Look, I think, could it be a short-term tool for some people? Possibly, but I don't think you're going to inject your way out of a poor diet. So could it be someone that gets all like this foundational stuff underway and this medication, which I would not advocate for, but I'm saying for someone that's choosing to do it, looks at their risk factors, are they a good candidate for it? Could it be like take them to the next level a little bit? Possibly, but it's not a long-term solution. Like what's the end game? That's where my mind goes.
And then I want to actually ask you like the metformin craze and all this. Like, is there a side effect to this? Is this okay? You look better, but what happens when you stop? And is there any other concerns that from any of these?
And oftentimes metformin or glucophage is paired with these other injectables. The goal, right, is to modulate insulin and leptin. There's a vast majority of people that have insulin resistance and leptin resistance. There are just more effective ways, in my opinion, without the potential risk factors that come with these medications. But look, low doses of them, short period of time. Could it be a needle mover for some people? Yes. But ultimately, in functional medicine, I'm like, what's the most effective, that's the least amount of side effects, and what's the most like sustainable solution for you? But metformin doesn't have tons of side effects. It does deplete methyl donors, meaning B vitamins. It can raise homocysteine levels. So there are some side effects to it. And that can make you shit your pants for sure. Glucophage can for sure.